take-home messages regarding when one is studying race and ethnicity is that not to attribute everything to biological differences, that we need to take into account aspects of the populations that stem from social and environmental factors that could be related within their community and as an individual. So what I'm talking about is to make sure that we are looking at social determinants of health when we're examining these minorities. These minorities, we're talking about African American and Hispanic populations that are our two largest minorities in the U.S. that constitute about almost 20% of the U.S. Population, right? Each one about 15% or so. And that we need to recognize that overall, their social position is lower. And those factors related to social positioning can affect any type of chronic disease. So meaning we need to think about race and ethnicity as health disparity, because there is health disparities within MS, right? We see differences in how many are affected with MS, right? We know it's predominantly in whites, but we've seen changing demographics. Why are African Americans now at higher risk, or at least within those periods that they were studied? And why do we see that the African Americans appear to have more severe disease? Is it a biological difference, meaning genetics, immune response differences that relate back to, exposures to the ancestors, right? Example would be the hypertension issue, right? Or are we talking about that they just start lower because they have poor access to health? Okay. They got to treatment later. They didn't take the treatment correctly. They don't make it to the doctor on time, not because they don't want to, because they have other barriers that are social barriers. So those things are really important. The other thing that I do want to make a point also is that as researchers, we need to also not just take race and ethnicity as any, small little variable. We need to be cognizant and use the correct methodology depending on what we want to answer. So we need to better define our race, how we ascertain race, how we ascertain ethnicity, and if we're going to ascertain ancestry, right, obviously that goes to the genetic admixture differences. So those, I think, are my points to take home.